Third party, House Leader.
Thank you, Honourable Speaker. The report on reforming the Police Act recommended improving the province's response to mental health emergencies. When a crisis occurs, we must use an appropriate response. A mental health crisis does not often fit into the existing options of police, fire, or ambulance. Adding a mental health option to 911, as recommended by the Police Act Committee and the Canadian Mental Health Association, would vastly improve well-being and safety of British Columbians. Through you, Honourable Speaker, to the Minister of Public Safety and Solicitor General, will you create a fourth option to 911 that is dedicated to responding to mental health calls with the appropriate level of response?
Minister of Public Safety and Solicitor General.
Thank you, Mr. Speaker, and thank you to the member opposite for his question. He is correct. The Committee to Reform the Police Act has examined at length an option when you call 911 for mental health to be identified. That is something that currently is underway, and in the near future I expect that there will be a determination made that will satisfy his question. Thank you.
Member supplemental.
Since the year 2000, there have been more than 800 deaths in Canada due to police use of force. Black and Indigenous people comprise less than 9% of Canada's population, but account for over 27% of police-involved shooting deaths. Many of these victims were experiencing a mental health crisis at the time of their deaths. These deaths were preventable. Peer-assisted care teams have had a demonstrable impact in the communities where they are operational, showing that there is a path forward for non-police emergency response. Through you, Honourable Speaker, to the Minister of Public Safety, when will your government modernize emergency mental health response by expanding peer-assisted care teams across the province? Thank you.
Minister.
Thank you, Mr. Speaker. The member opposite raises an important question about policing and how it is enacted in this province. On the Committee to Reform the Police Act, one of the things we looked at was various response that are not police-related, things that very clearly from the outset do not have their base in criminal activity. You will be pleased to know, member, that the conditions that govern police as it relates to responding to persons with mental illnesses have been adjusted all across the country, so that one of the things they consider first is whether or not the base is a mental health issue. Now, various jurisdictions across the country, including in British Columbia, have made allowances and do have today peer-assisted teams at work throughout the province.